and they were looking okay, and then they would look not so good, and then we would get better circulation, and they would look better quickly. That's happened a few times to us. I've been following you for quite some time with these wounds, but this last episode appears to me to have been a little too much for these legs to handle.
So am I in trouble?
You're not in trouble.
Can I pay the same fee?
You can always pay the same fee.
The other 3 wounds do not show infection down to the bone. Only the one on the ankle. But you've got that information. Okay.
The thing about that is not to throw something else in the mix. However, this ankle, as you know, had been open, closed. At one point, about 2-3 years ago, it was down to bone. And she was treated with the IV antibiotics.
Right.
So, I'm not, this is going to be hard to follow my logic here. I'm not going to say it's not a bone infection because the scan did show increased activity there. But you have a history of a bone infection there that the bone may never have been 100%. The only way to definitively say the bone is affected is to take a piece of the bone and send that to the lab, which I'm not willing to do.
Oh, interesting.
Okay?
Because
the bone scan is read as there is uptake of the dye in the ankle bone consistent with osteomyelitis or a bone infection. The radiologist isn't even going to say that is a bone infection.
Interesting.
Okay.
Well, I thought that because what I got from Debbie was he was confirming from the test that the ankle does have infection as deep as down to the bone again. But, okay, I'm with you.
Yeah, okay, so, but the prudent thing to do is looking at the information of the increased uptake on the bone scan, the duration of the wound, this interval, this is the longest it's been open, that is consistent with the bone infection, and it's prudent to treat the bone infection, okay?
Yeah.
So if you're following that, I can't say the percentage, I'm 100% sure it's a bone infection. I'm not 100% sure, given your history.
Well, and I questioned Dr. DeMayo when he was suggesting going back with the injections
Am I looking
again.
at cancer?
No, you don't have cancer. We're talking about your wounds, these ulcers, and the healing of it.
Oh.
And he said, 4 to 6 weeks type deal. And because of my knowledge of what happened last time, I pressed him a little bit on it so that Debbie didn't have to do that. As to, that turned into a 14-month daily thing, Saturday and 7 days a week. And I tried to get him to explain to me how that could even be possible. I mean, we're either healing something, fixing something. These daily injections are working, or they're not. 14 months. And he kind of looked at me like headlights in the and he didn't have an answer, nor did he want to pursue that particular conversation. But I mean, we're talking about Mom having to go back in for 3 days or whatever in the hospital to begin the process, and then she'd need to go to a facility to continue that process. There's absolutely no way that could be done on a daily thing again. And it looks like we may be going there. We'll know more after next.
Are you thinking that I have cancer?
No, I don't think you have cancer.
Thank you.
You just have a couple ulcers that are very difficult to heal with a couple things working against us here.
Are they getting better?
No, they're not.
Well, what do we do?
Well, that's what we're talking about. That's what we're trying to figure out together here.
Let me ask you, and this may be an unfair question for you, but
Okay.
I'm going back to that.
May or may not
I'm going back to
answer,
that
I'll try,
14-month deal. You ever heard of anything like that before?
Here's what I'm not sure. I'd have to look into the details. I'd have to go back to the chart of the 14 months.
Because that was only supposed to be a 4 to 6 week deal too.
Typically, a bone infection can be treated with IV antibiotics for a 6-week course. Sometimes the infection doctors will then extend the course of the antibiotics, but with oral medication, and that's called suppression. So if you've been on IV antibiotics for 6 weeks, the literature says a 6-week course, 50-something days or so, okay? When I've worked with infectious disease doctors and the wounds have not been healed yet, in order to cover the bases, they will often put folks on a pill for an additional several months, but not IVs for 14 months.
That's really got it's a flag that's there,
Okay.
and I'm bothered by the fact that more so for Dr. DeMayo, so far I haven't gotten him to respond to me the way I want him to respond to me on that.
Okay. Yeah, I'll have to go back and look into the notes that I have. I don't recall her being on IV antibiotics for 14 months. Okay, if she was, you'll take your word for it. I don't know. I guess I'll have to look at the records.
Well, Debbie said that she or Richard were taking Mom every day.
Months.
14 months. I said, you mean weeks? She said,
Yeah,
no,
that's-
14 months. She corrected me on it. That one of the two of them, and she just said, there's no way I can do that again.
Okay.
I'm surprised you did it the first time.
No, that is 1 year and 2 months is not an appropriate.
And she said,
course, yeah. No,
we're
that's not
talking
happening
7
again.
days a week, because that facility apparently is open on Saturdays and Sundays, but every single day. And I just thought, somebody needs to provide some why.
No, I agree.